Good, happy Tuesday morning, April 7, 2020. I'm Riley King, and welcome to the Riley King Newscast, right here on the Riley King Network. We have a lot of news to get to this Tuesday morning, so let's begin. First up, we're going to begin with your coronavirus disease, COVID-19 in New Hampshire, what you need to know. Let's take a look. Here's your COVID-19 in New Hampshire. There are 715 number of people in New Hampshire who have tested positive for COVID-19. 1,337,749 number of people worldwide who have tested positive. 9 number of deaths from COVID-19 in New Hampshire. 103 number of people hospitalized with COVID-19 in New Hampshire. And 10,689 number of deaths from COVID-19 in the United States. And this map of New Hampshire shows where COVID-19 cases are in the towns and cities of New Hampshire. Manchester, 116 cases of COVID-19. And then this graph right here, new cases each day in New Hampshire in the purple, daily new positive COVID-19 cases. In the orange, new hospitalizations, and in the red are the deaths. And your common symptoms: fever, cough, and difficult breathing. How it spreads, and prevention tips. And that is your COVID-19 in New Hampshire, what you need to know. New Hampshire hotels, Airbnbs, told to end non-essential accommodations to slow COVID-19 spread. Rooms still available for essential workers and domestic violence victims. Let's take a listen to that video from WR News 9.
In this life, there are only so many things you can count on. The sun rising every day.
Effective immediately, all hotels and short-term rentals like Airbnbs must suspend lodging accommodations for non-essential reasons like vacations and other leisurely purposes.
Governor Chris Sununu says the move is meant to keep out-of-state visitors from overrunning our systems. President and CEO of the New Hampshire Lodging and Restaurant Association, Mike Summers, was not surprised by the move.
Once we saw that the Vermont and Maine governors had taken that step, it was pretty even odds that it was going to happen in New Hampshire as well. And I think a lot of the industry right now was probably pretty slow anyway, just the uncertainty of folks. There weren't a lot of travelers out and about as it is, so certainly expected that something was going to come down the pike.
Guests who are currently staying in hotels or Airbnbs can stay through their current reservation, and some establishments will still be allowed to function in a supportive role. For example, providing housing to essential healthcare workers, first responders, and victims of domestic and sexual abuse, something the industry is now focused on.
I think what we'll probably switch to now as an industry is really trying to figure out, who's going to stay open and take care of emergency personnel and the folks that need to be taken care of and sheltered at this really tough time.
The closures will remain in effect until May 4th.
This isn't an issue where you have days and weeks to really ponder some really big decisions. You have to look at the data, you have to bring your team together, listen to the inputs, weigh the pros and cons, and you have to react.
Hospitality employs nearly 70,000 people in New Hampshire, many of whom had already been laid off. The New Hampshire Lodging and Restaurant Association established a relief fund. They've raised $113,000 to date. They plan to use that money, hoping to bridge the gap for some of those employees until federal relief kicks in. Live in Manchester, Jason King, WMUR News 9.
Okay, and there you go on that video and that report. %26 of confirmed COVID-19 cases in New Hampshire are in healthcare workers. State aim to make sure personal equipment in place. Let's take a listen to that video from WR News 9.
Dynamically work with your Webflow data. Make updates to your site. Get custom alerts.
Even though I'm working in the midst of, this whole fiasco, I also feel very comfortable with the garb that I have on.
He works in southern New Hampshire. He's a 38-year veteran respiratory therapist working on ventilators like these. He asked us not to use his name.
God forbid the day comes when we're not able to be provided with that proper equipment. That's when we will be extremely nervous.
His age puts him in a high-risk category, and the statistics show healthcare providers are getting sick at a faster rate than most, and New Hampshire is not yet at peak.
Right now we have enough people. We have enough employees to handle what we have for a workload. But if the future ends up being like New York, then all bets are off for everything.
State health officials today announced New Hampshire is receiving 15 Avid ID rapid test machines.
That testing device is going to change how we respond to this virus in our state. It's going to help us keep our citizens safe. It's going to help us keep our healthcare workforce safe.
Not all healthcare workers with COVID-19 were exposed on the job. Some were exposed via international travel. But officials say even one exposure is too many.
We are concerned that we may not have enough in every region of the state at the time when there is a surge.
This afternoon, the state announced they have a system in place to redeploy healthcare workers to the regions of the state that need it most. In Manchester, Amy Cavino, WMUR News 9.
Okay, and there you go on that video and that report. Mobile COVID-19 testing site in Manchester shuts down. Officials say testing can be handled by area hospitals. Let's take a listen to that video from WR News 9.
We're sure there's a true crime series you can catch up on. That's the mystery. Get phone service for just $40 a month for unlimited everything on Verizon's 4G LTE network. Visible. Welcome to the future of phone service.
Since opening on March 14th, Manchester's COVID-19 testing site at the New Hampshire National Guard Armory has tested about 1,000 people from the greater Manchester area.
It really was to come up with a central location to pool resources and efficiently deliver that service of testing for clients of our health systems.
But as of today, the city is no longer offering that service. The site was used to filter people away from hospitals, and with private facilities now offering COVID-19 testing, city health officials say the armory is no longer needed.
The testing site served its purpose for when we were operating it, and now that it's not as much of a barrier or burden for our healthcare partners to take on those aspects, we're able to say, okay, now what are we going to use our staff for?
A general shortage in available personal protective equipment also played a role. Masks, gloves, and gowns used at the testing site can now go to local hospitals that need them.
By no means is Manchester lacking in testing because of that. It's just that other organizations on the private side were able to step up, get some of the supplies that they needed to do the sampling and the testing.
People who were working at the Armory may now be rerouted to different areas in the city, including surge sites, to help with the increase in patients.
It made sense for us to think about resource needs, and we're really trying to switch our response now to community medical surge planning.
And now the city's health department says it will also focus more on the city's COVID-19 hotline. That number should be running at the bottom of your screen. It can be used for general COVID-19 questions or for help with basic needs such as food. Reporting remotely, I'm Tim Callery, WMUR News 9.
Okay, and there you go on that video and that report. Family recalls COVID-19 victim as transplant survivor who loved life. Sisters say Joanne Melody lived like each day was her last. Let's take a listen to that video from WMUR News 9.
Bar Harbor Bank and Trust understands life in northern New England. We think differently about banking relationships.
67-year-old Joanne Melody passed away 1 week ago. Her family says she was one of the vulnerable diagnosed with a genetic lung condition. She had a double lung transplant in 2007. Now they want her remembered more for her life than for her death from COVID-19.
She had a bucket list of everything that she was going to do when she got her lungs.
She went skydiving, hang gliding, and jet skiing, always promoting organ donation. The retired IT specialist lived in Washington, New Hampshire, in the home she built with her late husband. Her family cherishes the wedding they all attended in January, lunch with the 4 siblings 2 weeks ago. She was admitted to Concord Hospital the next day.
And the last time that I actually communicated with her was on Wednesday. In a text, and then she went on the ventilator.
The family is grateful for the nurse who held a phone to Joanne's ear so she could hear them.
They were just wonderful because it was heartbreaking to not be able to be there.
Now Joanne's family has one message to help other families. Please stay home.
She lived the last 12 and a half years, like each day was her last anyway, because she knew how special it was.
Jean Mackin, WMUR News 9.
Okay, and there you go on that video and that report. Health officials announced 46 new COVID-19 cases. 9 hospitalized, over 700 cases in New Hampshire. Let's take a listen to that video from WMUR News 9.
With more than 700 reported coronavirus cases now in New Hampshire, health leaders say the state is averaging about 50 new confirmed cases a day.
We're going to get through this. We really are in the next couple months.
Governor Sununu says the state has obtained more than 300,000 pieces of personal protective equipment.
We have worked around the clock to backstop this critical equipment for our healthcare workers and our first responders on the front lines of the crisis.
But the danger remains on those front lines. 26% of New Hampshire's COVID cases are healthcare workers. A respiratory therapist who asked us not to use his name says as of now his facility is well staffed. He hopes that's the case when our surge hits.
God forbid the day comes when we're not able to be provided with that proper equipment. That's when we will be extremely nervous.
Help is coming in the form of rapid testing. The state is getting 15 Abbott machines that will have results of COVID-19 tests in 5 minutes.
It's going to help us keep our citizens safe. It's going to help us keep our healthcare workforce safe.
Health officials also commenting on the CDC's mask recommendation.
Cloth masks for this purpose are intended to protect others from the wearer of the mask. Right, a cloth mask is not primarily intended as personal protective equipment.
While a cloth mask can protect others from you, again, officials saying the best way to stop the spread of this virus is social distancing and stay home. Reporting live in Concord, Mike Cronin, WMUR News 9.
Okay, and there you go on that video and that report. Dow features point to 600-point opening gain following Monday's sharp rebound. Stocks features pointed to a Tuesday opening jump in early morning trade, building on a steep rebound in the previous session. Detroit, New Orleans, and other coronavirus hotspots. Let's take a listen to that video from ABC News.
Look at the situation nationally. Look at the map 2 weeks ago. There were more than 30,000 cases in the U.S., and today there are 10 times as many with new hotspots outside of New York and Washington State. Authorities are warning us that this week will be this generation's Pearl Harbor or 9/11 moment. Victor Oquendo joins us now from Miami as the nation braces for the worst. Good morning, Victor.
Good morning, Michael. Normally this time of year, this would be the site of a huge county fair. Now it's been converted into a 250-bed field hospital. There are no COVID patients here yet, but they are ready, and other major cities across the country are taking similar precautions as they prepare for a surge in cases.
The next week is going to be our Pearl Harbor moment. It's going to be our 9/11 moment. It's going to be the hardest moment for many Americans in their entire lives.
With cases surging across the country, officials urging people to stay inside.
This is the moment to not be going to the grocery store, not going to the pharmacy, but doing everything you can to keep your family and your friends safe.
Authorities across the nation desperate to stop the spread. In Detroit, where some hospitals are already reaching capacity, they're transforming the state's largest convention center into a 1,000-bed field hospital, ready to open before the end of the week.
2 days ago, this was a blank concrete floor. Now we're putting 600 rooms into here with nursing stations.
Nurse Amy DeLine, on the front lines at Detroit Medical Center, lost 3 patients in a single night.
We're losing a lot of patients quickly. As soon as there's one death, you've got somebody else in the process of crashing, and you're running from one bed to the next.
Stay home except for essential needs. Help us flatten the curve and save lives.
In Louisiana, cases are spiking. The governor says they might run out of ventilators by Thursday.
We already have Louisiana's dying. We now think it's probably around the 9th of April before we exceed our ventilator capacity based on the current number on hand.
One economics professor telling the Wall Street Journal the virus is killing about 38 of every 100,000 people in New Orleans. That's nearly twice as many fatalities per capita as in New York City. Legendary Saints kicker Tom Dempsey, known for making what was once the longest field goal in history, passing away Saturday. He was 73.
It is time for us to be more serious about what we are facing as a city.
In Florida, where nearly a quarter of the population is above the age of 60, the bulk of cases are in Miami-Dade and Broward counties, where Shannon Bennett, a 12-year veteran Broward Sheriff's deputy, died from coronavirus over the weekend. Registered nurse Kyle McBride, just south of Orlando, choosing to isolate himself from his family to protect them, only interacting with his young children through windows.
You're in the line of fire. And so I knew that I needed to protect my family somehow, and I felt like this was the best way to do it.
And that nurse tells us he's now been away from his family for 2 weeks. Effective tomorrow, wearing some kind of mask or face covering will not just be encouraged, it will be a requirement on Miami Beach if you're heading out to the pharmacy or the grocery store. George? Hi.
Okay, and there you go on that video and that report. And that does it for this morning edition of the Riley King Newscast right here on the Riley King Network. I hope you all have a great rest of your morning, and I'll see you back here later on today for another newscast. And I'll have a news report coming up in a little bit. Goodbye, everyone.